So good evening, I am Mr. Joverick B. Amis from Iligan Medical Center College. So I'll be your nursing assistant for today. So I'm going to have an assessment or doing an assessment for the skin, the hair, and the nails for my patient. So first I'm gonna introduce to you the equipments that needed for the assessment. So I do have an alcohol, a gloves, here, a pen light, a ruler, a pen, and also an extra paper or a record paper for you to record the findings or the result that you have done from the patient. So good evening, sir. Hello. I am Mr. Joverick. So I'll be your nursing attendant for today. So I'm going to do assessment, sir, from your hair, your skin, and to your nails. So first, we're gonna do the inspect the skin coloration for the skin of the patient. So just keep in mind that the amount of the pigment in the skin accounts for the intensity of color as well as the hue. So you need to inspect the patient's skin. So the skin is normal, the color. So as I've observed that the skin of my patient is normal. So if there is an abnormal finding, so the pallor or the loss of color is seen in arterial insufficiency or decreased blood supply and anemia if there is an abnormal findings. So my patient has normal findings which the inspection reveals evenly colored skin tones without unusual or prominent discolorations. Okay. So, and then the next is you need to inspect the color variations of the skin. So, in assessing the skin color variation is you need to inspect localized parts of the body, noting any color variations. So far, there is no abnormal findings in inspecting the color variations of the skin of my patients. So there is just only a normal findings, which is the common variations include sustained areas or freckles or white patches known as the vertigo. So a generalized loss of pigmentation is seen in albinism. It's just only for albinism if there is color variations you've seen in your patient. So next is you need to assess the skin integrity for your patient. So in assessing skin integrity is you need to pay special attention to pressure point areas. So in skin integrity, so there is no abnormal findings that I've seen. It's just only normal, so skin is intact, and there are no reddened areas. So in assessing the skin lesions of my patient is you need to observe the skin surface to detect abnormalities. So far in the face face area, I've seen the pimples here in the right side and also in the left side, especially here in the lower of the lip here. It's around, and also in the forehead. So there are some pimples you've seen in the area of the face. So there's any lesions. So the abnormal findings is lesions may indicate local or symmetric problems. So the distribution may diffuse or what we call the scattered all over, and then localized to one area or in sun-exposed areas. So that is why the reason why the patient has some little problems on people's. I think it's just normal. Okay. So the skin of the patient is normal. There is no other abnormalities or abnormal findings that I've seen so far. I'm gonna check the mobility and then if there is any turgor. Sure. Feet. I'm gonna pinch. Okay. So far there is no mobility. The mobility of the skin is good so far, good. And then there is no turgor that I've seen or that I've observed from my patients. So now I'm gonna assess the head and the neck of my patient. So you need to inspect the head for the size, if it's normal, and then the shape of the face, the configuration, and then the involuntary movement of the head. So first is you need to inspect the shape of the head. So the shape is normal. There's no any alignment or abnormal alignment. And the next is the configuration. It's normal again, the configuration, and then the involuntary movement is. So and the involuntary movement is okay. So there's no the movement of the head of my patient is okay. So in palpating, you need to palpate the head. So in palpating, after the palpating the head, it's normal. So in the normal findings for my patient is the head size and the shape vary, especially in accord with ethnicity. So usually the head is symmetric. So round, erect, and in midline and appropriately related to the body size. And head should be held still and upright. So it's normal. And the head is normally hard and smooth without any lesions. Yes, head is smooth and hard. So there are no any lesions that you can find. But if there is any abnormalities that you can find or abnormal findings, which an abnormally small head is called the microcephaly, which you can find only if there is an abnormal findings to your patient. So the skull and the facial bones are larger and thicker in acromegaly. But so far my patient, it is normal. So I'm gonna assess. Next is I'm going to assess and inspect the face for the symmetry of my patient. So again, the skin, the face of my patient symmetry is normal. So symmetric with a round, and then oval shape, and then it is elongated and also or squared appearance. So there is no abnormal movements noted, or there's no abnormal movements that you have seen. So it's normal. So, next is you need to palpate the temporal artery of your patient. So, in assessing the temporal artery of your patient, which is located between the top of the ear and the eye, so which is here. So, and to assess the temporomandibular joint or the TMJ is to place your index finger here over the front of each ear as you ask the client to open their mouth, his mouth. Okay, sir. So, kindly open your mouth, sir. Make it wide, sir. Close. Then open. Okay. So there is no abnormal findings. So I can only find the normal findings, which is there is no swelling or tenderness or crepitation with movement. So the mouth opens and close fully 3 to 6 cm or centimeter between upper and lower teeth. Lower jaw moves laterally 1 to 2 cm in each direction. So far there is no abnormalities or abnormal findings to my patient. So next is I'm going to inspect the movement of the neck structure. Here, the neck structure. So in assessing the movement of the neck structure is to ask the client to swallow a small sip of water and then observe the movement of the thyroid gland. And while assessing the range of motion or the ROM, ask the client to turn the head to the right and to the left. So, and touch each ear to the shoulder, touch chin to the chest, and lift the chin to the ceiling. So, ask the patient first to assess the range of the motion or the movement of the neck. So, sir, try to swallow a small tip of water. Again, sir. Okay. So in swallowing, even a small tip of water is normal. So just need to observe the movement of the thyroid gland is okay while observing. And then the next is while assessing the range of motion is you need to ask the client to turn the head to the right, to the left. So okay, sir, turn to the left, right, and then to the left. Again, next. Okay, and then touch each ear to the shoulders, touch chin to chest. You need to do this, sir. You need to touch the air from your shoulders. Touch the air from your shoulders. So just like this, sir. Just like that. Touch the air. Touch the ear. Okay. Again. And the next. Okay. And then next is touch the chin to the chest. Chin to the chest, sir. Again. Okay. Then last is you need to lift the chin to the ceiling. Okay. Back. Then. Okay. So far, it's normal, and the thyroid cartilage and cricoid cartilage move upward symmetrically as the client swallows. And while in the ROM or the range of motion, normally the neck movement should be smooth and controlled with 45 degrees flexion and 55 degrees extension, and also 40 degrees lateral abduction and 70% rotation of the head. And then if you as a nurse can find abnormal findings, so asymmetric movement or generalized enlargement of the thyroid gland here, if there is an abnormal findings. So, but so far, there is no abnormal findings for my patient. I'm going to palpate the thyroid gland, use a posterior approach. So in assessing to palpate the thyroid gland is you need to stand behind the client, stand behind the client and ask the client to lower the chin to the chest and turn neck slightly to the right. So, sir, please do lower the chin. Okay. Okay, so up, down, okay, left, okay. Just move it to the right slowly, okay, back. So, and then next is you need to place your thumbs to the nape of the client's neck with your other fingers on the other side of the trachea. Okay. Again, sir, up, and then down, right, then left, then back. Okay. So far there is no abnormal findings. So the normal findings of my patient is the landmarks are positioned midline, and then unless the client is extremely thin with a long neck, the thyroid gland is usually not palpable. So as I've seen that my patient is thin, and then so I can see the thyroid gland, and then it's not really palpable at all. It's because the patient is thin. But however, the isthmus may be palpated in the midline. So if the thyroid can be palpated, the lobes are smooth and firm and non-tender. So the right lobe is often 25% larger than the left lobe. So, but so far, my patient is very normal. And then next, I'm going to palpate the lymph nodes. So in palpating the lymph nodes, the preauricular, which is the front of the ear, here, front of the ear, see here. And then the post-auricular, which is behind the ear, here at the back. And then the occipital, which is the posterior base of the skull, here. And then the tonsillar, which is the angle of the mandible, here. And then the submandibular, which is the medial border of the mandible. Submandibular is here. So, and then the submental, which is the few centimeters behind the tip of the mandible. It's just here. So, there's no swelling, enlargement, and tenderness, and no tenderness. So again, sir, try to swallow just like this, sir. Okay. And here, again. Okay. So far there is no abnormal findings. So the normal findings, there's no swelling or enlargement on no tenderness. So no swelling from a patient, and also no tenderness. No hardness is present, or the tonsillar is normal, and then no enlargement of tenderness is present, which is the submandibular. There is no enlargement or tenderness from the submandibular area. And also in the submental, there is no enlargement and also or tenderness is present. No, there's no. So in short, the patient's lymph nodes is normal. So sir, I'm going to assess now your eyes. So in assessing the eyes, you need to assess first the visual acuity of your patient, the eyes of your patient. So in assessing the visual acuity of the eyes of your patient is you need to test first the distant visual acuity and then ask the patient to read each line until he cannot decipher the letters or their direct. So I'm gonna ask the patient to read this in distance area. So, sir, can you read that one, sir?
Iligan Medical Center College.
Okay. How about here, sir?
Iligan Medical Center College.
Okay. So far, the in assessing or doing the test, the visual acuity of my patient is very normal. He has no any lesions, any problems from his eyes. So now I'm gonna test the near visual acuity using the test for middle age. So, but my patient is younger, but somehow we can still use it to assess the patient's visual acuity. So, and others who have difficulty with near vision or with reading. So, sir?
Iligan Medical Center College.
Okay. So far, the patient has a normal findings from his eyes. There is no any problems. So the normal distant visual acuity is 20/20 with or without corrective lenses. So my patient has no any lenses uses. So this means that the client can distinguish from 20 feet away. So my patient can distinguish or can read words from distance which is 20 feet away from him. And then the normal near visual acuity is 14/14 or 14/14. And then this means that the client can read what the normal eye can read from a distance of 14 inches. So, but if you can find an abnormal findings to your patient's eye, or the visual acuity of your patients, so you can see find myopia, which is impaired for our vision, and then which is present when the second number is the test result is larger than the first 20/40. And then, well, the presbyopia, which is the impaired near vision, if the patient cannot read near. So it is indicated when the client moves the chart away from the eyes and to focus on the print, and it is caused by decreased accommodation. So if the patient cannot read far, it is called myopia. And then if the patient cannot read near, it is presbyopia. That is the abnormal findings, if you can find. But so far, my patient is very normal in his eyes. So now next I'm gonna assess the visual fields for gross peripheral vision of my patient. So in assessing the visual fields of the peripheral vision of my patient is, you need to perform the confrontation test or the position yourself approximately 2 feet away from the client level. So just put it in your fingers, your cover.
One.
And then the other side, sir.
One.
Okay. So far my patient is very normal. So with normal peripheral visions, the client should see the examiner's finger at the same time the examiner sees it. So the normal visual field degrees are approximately as follows. So if your patient is very normal, the degrees that must possess your patient is 70 degrees for inferior. And then in the superior area, the patient must have the 50 degrees, and then the temporal must have the 90 degrees. And also in the nasal area, here, the nasal area is 60 degrees. So far, my patient is very normal in the vision, peripheral vision. So now I'm gonna assess the parallel alignment of the eyes of my patient. So in assessing the parallel alignment of the eyes, is you need to hold a pen light. So I have here the pen light. So I'm gonna use a pen light, so which is approximately 12 inches in front of the client's face, which is in front of the client's face. So shine the light toward the bridge of the nose while the client stares straight ahead. Sir, try to look at here, sir. And then you need to take note that the light reflected of the corneas, which is very aligned. So the normal findings of my patient is the reflection of light in the corneas should be in the exact spot on each eye, and then which indicates parallel alignment. So the lights when I am doing the lights, so so as you've seen, the corneas that is very exact on the spot of each eye. So it's normal. But if you can find an abnormal findings, so the asymmetric position of the light reflex indicates deviated alignment of the eyes. So that is the abnormal findings, and also this may be due to muscle weakness or the paralysis. But my patient so far is very normal. So next is I'm going to assess the eye muscle strength and the cranial nerve function, which is the cranial nerve 3, the oculomotor, the cranial nerve 4, which is the trochlear, and then the cranial nerve 6 is the abducens. So in assessing those 3 eye muscle, which are the 3 cranial nerve functions, you need to instruct the clients to focus on an object you are holding. So move the object through the 6 cranial cardinal positions on gaze in a clockwise direction. So just like this, sir. So just stay focused on this object, sir, ha? Okay, so far the eye movement of my patient is very normal. So the eye movement should be smooth and symmetric throughout all 6 directions. So far the alignment of the eye movement of the patient is very normal. Now I'm gonna inspect the eyelids and the eyelashes of my patients. The eyelids and the eyelashes. So far there is a white lesions that I found from my patient's eyelashes or the eyelids, but the rest it's normal. It's just a little white part. So this is the abnormal finding. So dropping of the upper lid called the pitosis, which we call the blepharoptosis, and then may be attributed to oculomotor, to nerve damage. So failure of lids to close completely and puts client at risk for corneal damage. So my patient has a white sclera in his eyelids so far, but just a little bit. So next is I'm going to inspect the assess the ability of eyelids to close. Open, then close, open, close. Okay, so the patient's ability of eyelids to close is very normal. So the upper and the lower eyelids close easily and meet completely when closed. So there is no abnormal findings with that. So next is I'm gonna inspect the lacrimal apparatus, assess the area over the lacrimal glands laterally as aspect of upper eyelids and the puncta, which is the medial aspect of the lower eyelid. So there is no abnormal findings. There is no redness that can be found from my patient's eye. And then so the normal findings is just no swelling or tenderness should be appear over areas of the lacrimal gland. So the puncta is visible without swelling or redness and is turned slightly toward the eye. There's no abnormal findings when I'm checking the lacrimal apparatus of the eye of my patient. So next is I'm gonna palpate the lacrimal apparatus. So in assessing to palpate the lacrimal apparatus is you need to put a disposable gloves to palpate the nasolacrimal duct to assess for blockage. So use one finger and palpate just inside the lower orbital rim. So I already have my disposable gloves. So I need to palpate the nasolacrimal duct to assess the blockage. So far, it is very normal. So there is no, so in normal findings from the eyes of my patient, it's very normal. So no drainage should be noted from the puncta when palpating the nasolacrimal duct. So it's very normal. So it's very normal. But if you can find abnormal findings from a patient's eye when palpating the lacrimal apparatus is express the drainage, which is express the drainage from the puncta on palpation occurs with duct blockage. So far it's very normal. So now I'm gonna inspect the pupil of the eyes of my patient. So you can find abnormal findings to your patient's eye pupil is which is round with a regular border is centered in the iris, which is the pupils are normally equally sized with 3 to 5 millimeter. Make it wide, sir. Just look at here. Just look at me here. So the pupil when assessing the pupil of the eye of my patient is very normal. So there is no abnormal findings that I've seen so far. And then in testing the pupillary reaction to the light. So in assessing to test the pupillary reaction to the light of the eye of the patient is the normal findings which you can find is to directly pupillary response is constriction or very normal. Just like this, sir. Just try to look in, sir. Okay. So the reaction of the papillary of eye of my patient when doing a light from a pen light is very normal. So there is no direct papillary response after giving a light. So next is assessing the consensual response of the eye of my patient. So the normal findings of this one is the normal consensual papillary response is very constriction. Just try to look there. Left side. And then look here. It's very normal. So there's no response constriction that I can find. And then next I'm gonna test the pupil accommodation of the eye of the patient. So in testing, you need to test the eye, the pupil of the eye, which is the movements. Look at left side. And then here. Then up. And then down. So far, in assessing the pupil, the pupillary reaction to light, and then also the consensual response, and the last is the pupil accommodation of the eye of my patient is very normal. So after testing, the pupil accommodation is the normal is the pupillary response is constriction of the pupils and convergence of the eyes when focusing on a near object. So there is no abnormal findings so far after assessing the perla or assessing the eye pupil of my patient. So it's very normal. Now I'm gonna assess the ears of my patient. So you need to look the shape of the patient, the ears of the patient, shape. So both sides. The shape so far is normal. So you need to measure the size of the ear of your patient. So the size of the patient is the size of the ear of the patient is very normal. So in normal findings is ears both ears of your patient is very equal and in size bilaterally normally, which is the 4 to 10 centimeter. So when I measured his ear, he has a 4 centimeter, and then the auricle aligns with the corner of each eye and within a 10-degree angle of the vertical position. Yes, it's very normal. So the earlobes may be free, attached, or soldered, or which is tightly attached to adjacent skin with no apparent lobe. So it's very normal. So next is I'm going to inspect external auditory canal and tympanic membrane. So I have here a pen light to use to inspect the canal of the ear. So far in assessing the external auditory canal and the tympanic membrane of my patient is very normal. There's no any small amount of odorless rumen. There's no odor. And then so normal findings is the small amount of odorless rumen or the earwax is the only discharge normally present. So the earwax or the cerumen of my patient's ear is very normal, and then the color of the cerumen may be yellow, orange. If you can find the normal findings of the cerumen of your patients is the color of the cerumen is the yellow, the orange, red, brown, gray, or black. That is very normal. If that color, if you can see in the eyes and the ears of your patient, which is the cerumen or the earwax. So far, the cerumen or the earwax of my patient is very normal. So I've seen a yellow colors, but it's odorless. So consistency may be soft. Yes, it's very soft. Moist. Yes, a little bit moist. And then dry. Yes, dry. And then also the flaky or even hard. Yes, it's hard. And then the tympanic membrane should be pearly gray. So far, after inspecting the external auditory canal and the tympanic membrane is very normal. So next is I'm going to palpate the auricle and the mustard process. The mustard process is here. It's very normal. So the normal auricle, the tragus, the mustard process, are not tender. So it's very normal. So next is going to assess hearing and equilibrium performed. So you need to do first the whisper test. Okay. So next is that you need to do the Weber's test. But I don't have an equipment which is the tuning fork. But I'm gonna explain it to you and how to use this Weber's test. So you need to put the tuning fork here in the head. After doing like this, the tuning fork, and then put it in here. And then the patients must feel the vibrations of the tuning fork inputting the tuning fork in the upper head. So the normal findings of that is the vibrations are heard equally well in both ears. If your patient can hear very well in both ears, the sound of the tuning fork that is normal, and then there is no lateralization of sounds either in both ears. So if the patients have an abnormal findings after doing the Weber's test, which the abnormal findings with that is with conductive hearing loss, the client reports lateralization of sound to the poor ear, which you can find if there is which part is poor to hear. The client hears the sound in the poor ear. So as I've said, so you need to find which part of the ear is very poor in hearing, which is the left or the right side of the ear. With sensorineural hearing loss, the client reports lateralization of sound to the good ear. But so with that, I have no tuning fork to perform to you. So but that is the way on how to perform the Weber's test. So next, I'm gonna assess to do the Rhine test. But in doing the Rhine test, assessing the Rhine test is you're gonna use the tuning fork. But I have no tuning fork. But I'm gonna explain it to you on how to assess. So in assessing the Rhine test, you need to compare air and bone conduction sounds. Ask the client to tell you when the sound is no longer heard. So if you have, or for example, if this is the tuning fork, so you need to do like this, and then put the tuning fork here near in the ear, and then ask the patient if how the sound is longer that the patient can hear, and then put it in here also, do like this also, and then put it in here, upper, which is the temporal area. So just like that, that is how to do the Rhine test using the tuning fork. And then if you can find the normal findings in assessing the Rhine test of the ears of your patient is the ear conduction sound is normally heard longer than bone conduction sound, which if you can find the abnormal findings of your patient's hearing or after doing the Rhine test is conductive hearing loss occurs when sound is not conducted through the outer ear canal to the eardrum and ossicles of the middle ear. And then possible causes include fluid in the middle ear. So in the middle ear infection, otitis, or what we call the otitis media, and then the allergies of the ear is what we call the serous otitis media. And then the sensorineural hearing loss occurs with damage to the inner ear, which is the cochlea, or to the nerve pathways between the inner ear and the brain. So this is the most common type of permanent hearing loss. So if you can find that abnormal findings in your patient, so you need to assess your patient with this Rhine test. So the next is I'm gonna do the Rum Bridge test to my patient. So I need to ask my patient to stand up. Thank you, sir. Stand. And then arms at the side, feet together, sir, just like this. Okay. And then stand straight, sir. Stand straight. And then ask the client that the arms is at side only. Just like that. And then eyes open. And then with the eyes closed. Open. Closed. Okay. So when the client, so in the normal findings of doing this Rum Bridge test, the client maintains position 20 seconds without swaying or with minimal swaying. So again, sir, without no swaying, no extra movement, sir. So eyes open. Close. Open. Okay. So far, after doing the Rum Bridge test, it's very normal. And then there is no abnormal findings. So the movement so far is very good. Is really good. So you can now sit down, sir. So now I'm going to assess first the mouth. So in assessing the mouth, the throat, the nose, and the sinuses. So I'm gonna do the mouth assessing. So first is you need to inspect the lips for the consistency and the color. So far, the lips is pink. There is a little bit crackness of his lips. The color of the lips is slightly pink. So there is an abnormal findings on my lips of my patient. So so far I've seen crackness just a little crackles or crackness in his lips. So next, you need to inspect the teeth and the gums of your patient. So you need to ask the patient or your client to open the mouth. So to take note the number of the teeth, the color, and the condition. Sir, open. Make it wide. So the teeth is complete. There is no any missing of my patient's teeth, but the color and the condition of my patient's teeth is slightly there is black, like a damage in the inner part of his teeth, and the color is a little bit yellow, and then you need to take note that any repairs such as crowns and any cosmetics such as veneers. So if you found out that your patient has or wearing any cosmetics in his teeth, that you need also to assess that one. So in dermal findings of in inspecting the teeth and gums, there are 32 pearly whitish teeth that you can find in the mouth of your patients, and in smooth surfaces and edges. So after, the upper molars should rest directly on the lower molars, and the front upper incisors should slightly override the lower incisors. So, make it open, sir. And then close. Okay. So far it's very smooth in opening and closing the mouth of my patient. So some clients normally have only 28 teeth if the 4 wisdom teeth do not erupt. But my patient, again, sir. So my patient has only 3 wisdom teeth because one of the wisdom tooth is already gone. So there is no. My patient is a non-smoker, and is also non-drinker of an alcohol, so that is why his teeth is a little bit healthy, and he's just drinking sometimes a tea or a milk, and then there is no any abnormal findings that I can find. It's just only the black part of his in the lower part and the lower part of his teeth that I can find. So that but so far it's normal. So next is I'm going to inspect and check the strength of the tongue. So you need to place your fingers external surface of the client's cheek, so here, and then check the anterior tongue's ability to taste, place drops of sugar and salty water on the tip and sides of tongue with a tongue depressor. Make it wide, sir. Can I see your tongue? Okay. So far, it's normal. So the tongue offers strong resistance and the client can distinguish between sweet and salty. So far. And then, I'm going to assess the uvula. So in assessing the uvula, you need to apply the tongue depressor to the tongue, but I have no tongue depressor so far, but I'm gonna introduce to you on how to do the assessing of the uvula. So inspect the tonsils using the tongue depressor to keep the mouth open wide. So inspect the color, the size, and the presence of the exudate or the lesions of the tongue. So make it wider. Make your tongue to the up. The color is okay, normal, then low. Make it out. Go sa bila. Side. Other side. So far, there's no any kind of abnormalities, but it's just the upper tongue is just a little bit white. Maybe it's just because of the food. So after assessing the uvula of the tongue of my patient is the normal findings is the uvula is a fleshy and then solid structure that hangs freely in the midline. So no redness or exuded from uvula or the soft palate. So the tonsils here, the tonsils may be present or absent, but they are normally pink and symmetric and may be enlarged to 1 up or 1 plus in the healthy clients. So no exudate so far to my patient. Swelling or lesions is normal. Yes, it's very normal. Okay, sir. Good evening. I am Mr. Jovrick. So I am your nursing attendant for today. So the assessment, sir, that I'm gonna do is assessing the thorax and lungs, and then the assessment that includes posterior and your anterior thorax. And then the techniques that I will be doing is per inspection, palpation, percussion, and auscultation. So the equipment that I'm using are the stethoscope. Here, the stethoscope. The pen marker, the ruler, and the note for you to take note the findings of your patient. So, sir, I'm going to do the assessment for your thorax. It's because it is necessary, very necessary, to determine the condition of your thorax and lungs. So before we start our assessment, let's do the hand hygiene first. Just to make sure to avoid transmission of the microorganisms. And then make sure to give a client's privacy. So, ask first the health history of to your patient, sir. Do you have any really cancers related with your family?
No.
No. Do you have any allergies?
No.
Okay, no. How about family, sir? Do you have a family related with tuberculosis?
No.
Okay, no. And then also, do you, how about your lifestyle, sir? What do you do in your lifestyle?
Doing exercise every day and playing playing basketball.
Okay, sir. So, how about, sir, any medications taken? Do you have a maintenance?
No.
Okay. How about your family related, sir?
No.
No. Okay. How about current problems, sir, such as cough or sneezing or fever?
Last past few days. Cough.
Okay. Okay. So first assessment is assessing your posterior and your thorax, sir. So stand up first. Sir. Okay. So you need to inspect the shape and the symmetry of the thorax from the posterior and lateral views. Okay, sir. Back, sir, back. Okay. So compare the diameter to transverse diameter. So the result of the thorax. So the result of the thorax is symmetric. So the next is to inspect the spinal alignment for deformities. Back, sir, back. Again. Okay. The spinal alignment is normal. So the next is palpate this posterior thorax. Front, sir. So the next is to palpate the posterior thorax. So the findings is uniform temperature and no tenderness and masses. So next is palpate the chest vocal tract fremitus. Yes, sir. Back. So you can use one or two hands, but I will be using two hands that are placed simultaneously at the corresponding area. So sir, while I'm doing the assessment, please say 1 to 3.
1, 2,
Say 1 to 3.
3,
1 to 3.
1, 2, 3. 1,
1 to 3.
1, 2, 3. 1, 2, 3.
So after palpating the thorax, the findings is normal. So the next I will be doing is to precast the thorax diaphragmatic excursion. So using the sir, I'm gonna do a diaphragmatic, sir. You can sit, sir. So sir, I'm gonna do a diaphragmatic excursion with your back, and I want you to do is to take a deep breath. Okay, and then let it out. Inhale. Okay. Just wait, sir. So far after percussing, sir, it takes that 4 centimeters distance from your thorax. So next, the next thing is to do the auscultate. So sir, I'm gonna auscultate your chest. No, just back here, sir. So to inspect the breathing pattern, so I'm gonna use, sir, the stethoscope. So sir, I want you to do the inhale and exhale. So sir, so far, sir, after auscultating your chest using my stethoscope, your chest part or the inhale or an exhale is normal. So inspect now at the front, sir. Okay. So now inspect the anterior thorax. Okay, sir. To inspect the breathing pattern, so your breathing is quite good, and the costal angle and the angle and the reach the ribs normally. So now, sir, I'm gonna do to auscultate the anterior, your breath sounds and your adventitious sounds. So first, you need to auscultate using the stethoscope the breath sound of your patient. So there's no problem, sir, in your breathing, and also the adventitious. The normal there is just a normal finding. So your anterior breath sounds and adventitious sounds is okay, and there is no problem. So next, first, I'm gonna do the posterior, the breath sounds. To best assess the lung sounds, you will need to hear the sounds as directly as possible. So do not attempt to listen through clothing or a drape. So you need to take off. So my patients already take off his cloth, which will produce additional sound or muffled lung sounds that exist. Back, sir. Again. Okay, sir. So far, sir, there are just your posterior thorax, which is the breath sounds and adventitious sounds, are very normal. So, which is your a well auscultated bronchial or the bronchovesicular, and the vesicular is very normal. And sometimes, sir, your breath sounds may be hard to hear with if you are obese, but as long but so far, since it's not. And then your adventitious sound is such as crackles. I have heard present it. So overall, sir, it's very normal.